Good afternoon, everybody, and welcome. I'm Kirsten Danis. I'm a deputy Metro editor here at the New York Times, and today we're going to be talking about two of my favorite places, New York and California. When we first heard about the coronavirus outbreak in China, officials here were most worried about the West Coast as the most likely landing place for an American outbreak. But it's months later, and I think we all know that it's New York that has become the epicenter. In particular, New York City, where I am talking to you from. Right now, New York has 89 deaths per 100,000 people, while California has 4. California, the largest state in the country, has far, far, far fewer deaths than New York. And there was vulnerability in both places. There's international travel, they both have major cities, and they both have diverse demographics with populations with deep ties to China. So what happened? Joining me now to talk about this are Times reporters from both coasts, Thomas Fuller in San Francisco and Jesse McKinley in Albany, New York. Hi, guys.
Hi, Kirsten.
Hi there.
Welcome. A quick housekeeping note before we get going. This conversation is being recorded and it's audio only, so I'm sorry you won't be able to see what we look like. You can submit questions for us anytime using the Q&A feature in Zoom. Please include your name and where you're listening from. I'll be trying to raise some of your questions periodically as we start our conversation, and then we'll leave time at the end to get to more of them. You guys ready to get going?
Yeah, let's go.
All right. So let's start with one of the most clear reasons that it seems like New York and California had such different outcomes, and that's timing. Thomas, can you bring us back since you know it's hard to remember what happened yesterday as opposed to what happened 3 weeks ago. Can you walk us back and tell us, remind us how California made the decision to close and when that was?
Okay, and this is part of what I've been calling the California conundrum, because the earliest signs of the virus were on the West Coast. We had a Washington case, and just last week we reported on February 6th, the earliest death in the United States associated with the coronavirus happened in Silicon Valley. So that's February 6th. And then it took more than a month for the Bay Area to become the first area in America to issue stay-at-home orders. So that was March 17th, and then 2 days later, California followed on the 19th. But it's important to point out that in those intervening weeks when the virus was first spotted here, so again, that was before that death, February 6th, it was late January, the first cases were spotted. Between that time and between the stay-in-place orders, there was a lot of activity. There were a lot of warnings, and by activity I mean a lot of tech companies were telling their employees to work from home, which is part of what separates the West and East Coast. That a lot of
was there political pushback into the decision to close? Was that a popular opinion, or Californians understandable about it?
Californians were pretty good about it, and that's maybe another one of the things that set apart East and West Coast. The Californians are used to emergency orders. They're used to being warned about earthquakes. Last summer we had power outages because the power lines were causing fires. There's the wildfires that we've had for the last few years. So Californians took it pretty well. They the roads were, I would say, a good barometer was that the roads were empty even before the stay-at-home orders came down.
But here in New York, we weren't quite as quick to react, and there was a lot of bickering and dithering back and forth. Jesse, can you talk to us a little bit about why New York was slower to react than California?
Well, I think a number of things were going on. I think obviously when you're talking about a city like New York City, the politics there are complicated. They are, and obviously there is friction, to say the very least, between Mayor Bill de Blasio and Governor Andrew Cuomo. I think it's indicative of how far apart these guys can be on certain issues, that the last time they appeared together in public was March 2nd, which was the first day after they discovered a confirmed case here in New York. So they haven't been on a stage together since then. But I think even more than that, New York had differences from California and challenges, I think, from the very get-go, beyond politics, which obviously we'll probably get into, but the density of New York City is obviously an intense challenge for a highly infected virus like this, as is the inordinate reliance on public transit. Not only in the city itself with the subway system, but with connecting regional railroads, which link New Jersey, Connecticut, and Long Island with the job centers there in New York City. And so trying to kind of get your arms around this virus early on were complicated by the very fact that you had millions of people kind of coming and going in close proximity day after day after day. And then, of course, the state didn't get around to actually shutting down until March 22nd, which was 3 days after California. So those two factors, the density, the people kind of living on top of each other, working side by side, traveling side by side, coupled with the fact that the state and the city did not really shut down until, late-ish March, when you already had thousands of confirmed cases and people starting to fall very, very ill. I think those were factors that really hindered New York from having the kind of success that California has seen thus far.
Jesse, I think I just read, I had read or reminded myself that Mayor de Blasio in New York City was urging people to go out and live their lives and go out on the town as recently as March 2nd. And we now know from genome tracing that as of then, there might have been as many as 10,000 cases already in New York.
Yeah.
Have you heard, has there been any note of regret or revisiting this on the part of officials?
I think just the caveat with all of this conversation, I think, the postmortems on this are going to be writ for months and years and probably decades to come. Yeah. So there will be a lot of kind of analysis as to who did right and who did wrong. But that being said, early on, you're right. De Blasio was telling people, let's not panic. I distinctly remember sitting in a room with Andrew Cuomo, the governor, and him saying, this is not Ebola, it's not Zika, it's not SARS. And while the point he was making was that, those diseases are kind of much more frightening in terms of their contagion and fatality rate, him trying to strike a balance between, not freaking people out, but also making sure that people were aware that this is going to be a problem, but it's not going to be that bad of a problem, trying to constantly kind of walk that fine line between alerting people but not alarming people. There were times when both Bill de Blasio and Andrew Cuomo did it well, and there were times when it went the wrong way. I think one of the most kind of graphic examples of that was when, Bill de Blasio said, we're going to shut down the gyms, and then promptly went to the gym the next morning. So it's that sort of thing that doesn't, that probably history will not look so kindly on.
Jesse, you touched a little bit on density. New York obviously is the most dense city in the country. San Francisco is the second most dense city. So maybe Thomas, you could talk a little bit about what the other differences between a city like San Francisco, which is very much an urban center, and New York, and why density may or may not have made a difference in both those places.
Right. So yes, San Francisco is the second most dense city, but it's significantly less dense than New York, and it's very different in its car culture. There are 2 people for every car in San Francisco. That's about the ratio is much different in New York. It's about 1 car for every 4 people. San Francisco is a very small city. I mean, it's smaller than I think every borough. It's 900,000 people, so it's 1/8 the size of New York. There's a culture of working from home, as we talked about. There's a culture of being outside. If you kind of go down the checklist of what epidemiologists, health experts tell us, where is it best? What are the best places to be during this epidemic? outside, check. In your car, not in contact with other people, check. Working from home, check. All of these things are California traits. And yes, there is density, and there have been studies out of China that show, there's a study coming out in Science that shows a definitive link between density and the spread of the disease and the duration of coronavirus. But there's also all these other factors that come into play. In other words, there's not you can't say, well, necessarily a place is more dense, it's going to have more, spread of disease, but that certainly was a big factor.
Jesse, I think you raised a statistic this morning that, although is pretty alarming. On any given day, the MTA, the subway system here in New York City, carries 5.6 million riders, and BART, the transit system in San Francisco, carries 400,000. So even under normal circumstances, perhaps we're not seeing the kind of contact that we would in San Francisco that we do in New York City.
Yeah, absolutely. And I'd like to caution that I had to look that up. I didn't just know that off the top of my head. That would be weird. But yeah, I mean, absolutely. I think Tom makes great points there. I have actually been lucky enough to both work in San Francisco and New York City. And one of the things I learned about San Francisco very quickly is that part of the allure of that city is not what is in the city. There's a lot of great places to go outdoors outside of the city. You go hiking in Marin, you go to the East Bay, you go to the peninsula, you go places like that. Whereas if you're living in New York City, even if you go outside, you tend to go to places like Central Park, which can be completely overrun on a sunny afternoon. So getting away from density is not just getting away from the subways. The sidewalks are crowded. And earlier today, Bill de Blasio kind of relented and said, okay, we're going to shut down some streets so that people have places to walk around in the street, simply to try to get the sidewalk density down. Just because, you run out to get a cup of coffee, you might come within that kind of 6-foot danger zone of a half a dozen, 2 dozen people just running to Starbucks. So that sort of density, I think, really just intensified the spread of the disease, and unfortunately the catastrophic results we've seen.
Well, I think on this, a listener asked an interesting question, and Jesse, you might be in some position to answer this. Barb asks, how is upstate New York being impacted as opposed to New York City?
It's a great question. And it's curious when you start to look at the statistics. Obviously, upstate New York is not has not been impacted anywhere near the way the city and its suburbs have. But, I was doing some reporting earlier today. What you are starting to see is in places where people are in close contact, and particularly heartbreakingly in places like nursing homes, even in upstate New York, you're seeing death tolls there, and that's where people are in close proximity. They may not be, they may be exposed to the medical system either by going into the hospital or coming out of the hospital. So I think that there is going to be pressure, obviously, in upstate New York to try to open and try to return to normal. But one of the things the governor has been very strident about the last couple of days is, look, you can't have big fairs and theme parks and things that drag a lot of people, a lot of strangers into close proximity with one another, because the disease doesn't care about county lines, so it doesn't care if you're in New York City or if you're in Onondaga County, So I think vigilance in that regard is going to have to be critical, as is, fighting off this kind of perception that, there's certain parts of the country where it just won't hit.
Thomas, what's the reaction been like in the more rural areas of California?
Well, that is interesting too in terms of the relationship to density, because if it were density alone, then you'd say, okay, fine. So then let's have, the counties in California affected by this would go in order of density. They don't. Los Angeles, for instance, has more cases per capita than San Francisco, and Los Angeles is obviously a lot more spread out. One of the worst hit counties, some of the worst hit counties in California are very rural on a per capita basis. So there is not, there's certainly not a direct, easy correlation with density. On the other hand, there was just a letter on Friday to the governor of California by 6 counties in the far north of the state, near the border with Oregon. And they said, hey, look, we've had so few cases, we want to reopen our economy right now. So, it goes both ways with density, but certainly Tulare County, which is in the Central Valley, Mono County, these have been very badly hit, and they are very agricultural, very rural.
It's really fascinating. One thing that you'd think California would have had a real leg up on is testing, which I think of it as being such a big hub for tech, for biotech, for people to adapt and innovate very quickly. But it seems like California had the same or even worse problems with testing than New York did. Can you speak a little bit to that, Thomas, and just talk about how much that affected their reaction and their containment, or if it did at all?
Tess, this is one area where New York was far ahead of California. As of April 20th, California had 7 tests per 1,000 residents. So it was, I think it's the 3rd lowest among all 50 states. So California is still not there. Why is that the case? I haven't found a single coherent explanation. You point out the universities here. I mean, within a half an hour drive from my home, there's the University of California, Berkeley. You go a little further, I get down to Stanford. These universities are now leading testing efforts here. But when the outbreak first began, they were just on standby. They were waiting. There was that whole, problem with the CDC tests that everyone was relying on. All the samples had to be flown across the country to Atlanta, and then the results, sent back. So there was a huge lag, and the state has not yet been able to ramp up appropriately, which will be a problem for the next phase. Reopening, because the governor, Gavin Newsom, says this is one of the most important conditions for reopening, is that there be adequate testing.
Max, our listener, asks, can you both speak about the current thinking in regards to antibody testing in the 2 states? How doable is widespread antibody testing? How crucial is it to reopening efforts? Do we have good antibody testing? We've read a lot about the poor imported antibody tests that are pretty unreliable. Maybe, Jesse, you could start with this one.
New York State seems pretty confident that they've got a pretty reliable antibody test. That's a lot of pretties for one sentence, but they do feel confident that they do have a test that they developed themselves that's going to work. Now, how widespread that is a much less impressive number at this point. The governor unveiled today that I believe they had done about 7,500 antibody tests just to kind of get a sense of how widespread the virus is in New York State. There have been other antibody tests done elsewhere, but once again, that has lagged far, far, far behind diagnostic testing, i.e. the test that just tells you whether or not you're infected. But in terms of its importance, the governor and other state officials have said this is a critical tool to figure out not only how widespread it is, so, how many people have had this, but conceivably, who might have antibody loads that could be used in treatment for people that are actually suffering from this. That's one of the experimental kind of treatments that they've been playing with, as well as potentially using antibody results as ways to figure out who's recovered and who could basically re-enter the workforce. Now, with everything involved with this story, there's a million caveats, and the World Health Organization came out on Friday and said, look, there's no guarantee that having antibodies in your system will prevent you from being reinfected a second time. Now, they didn't say that it wouldn't be, that there wouldn't be some sort of immunity, but they didn't say that there was evidence that there would be. So once again, I think they view antibody testing as one of the tools in their toolkits to try to get kind of good data on this so that they can just figure out the scope of what they're dealing with. And the data they saw today was that basically 25% of those people that they tested in New York City came back positive, which is a huge cohort. I mean, if you extrapolate that to the population of New York City, that's over 2 million people. So that's a big number.
Thomas, is California developing its own antibody test, and does it have any plans to do widespread testing?
So a number of universities, there are a number of studies that are either ongoing or just about to start, where thousands of people will be or have been tested. But I had some reporting last week that suggested that it was still difficult to get an antibody test. I was speaking with the family of a homeless man in San Francisco. He had gone into the hospital in December with symptoms that looked very similar to COVID-19. And his family just last week requested an antibody test. This was at UCSF, which is one of the major universities out here, one of the major research centers out here. And they took a long time to decide whether or not they should allow this test. His doctor did, and eventually they did give him the test, and it came up negative. But I thought just that one anecdote showed that something which, if you're in the hospital at a major research center, you figured that would be a lot easier to get. And now you have to think about how big a state California is and all the rural areas that would, where you're not. Where you're not in the middle of all these research efforts, and where presumably it's going to be even harder.
I think that one of the things that we talk about when we talk about testing is whether or not we can rely on it to reopen, or how important is it going to be to reopen? And what are you hearing, Thomas, in California about the possibility of reopening, and how might that compare to New York?
Well, it's interesting. I think the parts of reopening that we all latch on to are the things that we can relate to in our everyday lives. Like, for instance, can I go back to a restaurant? What is that going to look like? Can I go back to work, et cetera? And this is one area where the governor has said, well, you will be able to go back to restaurants eventually, but there'll only be half the tables. Your server is going to have a mask and gloves on. You'll have paper menus. And when I think about going to a restaurant where I live, and I think about the contrast with Manhattan or Brooklyn, the space constraints that you'd have at a restaurant there, I think that's just sort of a metaphor for how much more difficult it might be in New York to have this type of return to normalcy, because in California you're a lot more spread out. You don't have the extreme premium on space, and as it is, you can walk into a restaurant in San Francisco and walk between the tables. And certainly in LA, people eat outside very often. For a longer period than you can in New York. In other words, it's already, I don't want to make everyone jealous who's, in a colder clime, but, it's pretty darn nice out right now in California. So I think that will be a challenge going forward, that, there's just, how in a Manhattan restaurant can you have social distancing?
Well, it is pretty darn not nice here in New York. And Jesse, maybe what Thomas said explains a little why the governor here in New York is taking some very tentative steps to reopening, but not anywhere near the city.
Yeah, no, that's true. And I just want to note that it's 45 degrees and raining here.
It's just awful here.
Yeah, so Thomas, I hate you. But anyhow, the governor is being exceedingly circumspect in moving towards reopening. And I do think that part of that is, once again, you're talking about more than 17,000 people have died in this state. And that, the numbers can just get kind of numbing after a while, but that is an enormous, catastrophic human toll. And it has not simply been in New York City. It has been in its suburbs, Nassau County, which is an affluent, kind of very, kind of well-developed, good healthcare system, comfortable suburbs out there. They've lost 2,000 people in Nassau County alone. So, this has really been widespread. It's hit Westchester County and Rockland County, and, even up to the Hudson Valley. So in looking at places where, you've got a relatively small number of cases, it's not a very lengthy list, but there are certain places up here near Albany that will see some resumption of construction and manufacturing, which once again kind of fit the bill for this sort of reopening in a couple of ways. One, you can control that workspace conceivably. You can take people's temperatures when they're going into a factory, and you can take them when they're coming out. If someone gets sick, you can quarantine them. While sometimes you are working in close proximity to people, oftentimes you can kind of, assembly line that out to an extent and try to maintain a little bit of distance there. Construction sites also, people can be on top of each other, but you can check the crew for, fevers and symptoms and things like that, and try to maintain some semblance of control over those kind of small cohorts of people. Where you run into trouble, of course, as Thomas mentioned, were things like entertainment and restaurants and bars and state fairs and places like that I don't really see a tenable mitigation strategy for these coming very soon. These are going to be places where a lot of people congregate. And so the governor has been very, very careful about giving anybody hope that these sorts of mass gatherings are coming back anytime soon. One great thing in Thomas's story a couple of weeks ago is he mentioned things like, waiters in gloves and disposable menus and things like that might be used in those sorts of environments. And we're still waiting for those sorts of details in New York to see if that sort of thing happens.
I want to get to some of our listener questions here, some really great, insightful questions. One listener asks, can you address that there might be different strains of the virus, like one from China, one from Europe, and that the strain that hit the West Coast was maybe not as severe as the one on the East Coast? Now that we're starting to be able to map the genome, we got the surprising news a couple of weeks ago that perhaps what hit New York did not necessarily come from China. Maybe we were looking at the wrong place. So is that something maybe, Thomas, you have some insight into?
Gosh, I mean, the only thing I can say is that I haven't heard, we had the story a few weeks ago that says that the virus seems to have traveled via Europe, more specifically Italy for the East Coast, and then come more directly from China for the West Coast. That makes sense. But whether or not these viruses are significantly different, I haven't heard that anywhere. And they're still in the early stages of sequencing all of the virus that they're finding. So, that by sequencing the genetic makeup of the virus, you can kind of track, where it's been and how many generations it's been in a certain area. But I certainly, that's not something I've heard, that the actual severity of the virus is different east and west.
Yeah, I mean, I don't think what I've read is that it can mutate once every couple of months, perhaps, so that the mutations might not be so significant. But it's certainly something that would be really fascinating to track as we go forward. Jesse, Susan asks if the new New York State budget, which was being passed just as the full force of the epidemic was hitting us, has cuts to education and health. Is it going to cause problems with recovery from the virus?
I don't know if the budget as passed in April will, but absolutely the impact of what has happened since the epidemic took hold will absolutely affect, I think, a lot of state functions and local functions by extension. Today the budget director was talking about potential 20% cuts to schools. The governor floated up to 50% cuts to schools. Those are shattering numbers for people that are trying to put textbooks and Chromebooks and all sorts of things in front of kids to learn. And keep in mind too, that you're already dealing in the educational realm with hundreds of thousands of kids upstate and more than 1 million kids in New York City who have been out of school now for week after week after week. And now putting on top of that, you may have some pretty severe budget cuts. That's really it's gonna be a difficult pill to swallow. The estimates at this point are somewhere in the ballpark of a $13 billion hit. But I really don't think anyone knows just yet, because we don't know when the economy will restart. We don't know even when the economy restarts, how long it might take tourism to come back to New York City. You know, I used to cover Broadway, and I spoke to a Broadway producer a couple of weeks ago, and they are not optimistic that the foreign tourist market, which makes up, I think, about half of ticket sales on Broadway, they don't think that those people might not come back for a year or two. And that is a really daunting reality, that not only for entertainment venues, but also for restaurateurs and people that run bars and people that, you know, give tours around New York City. Those are all going to be frightening calculations that people are going to have to make if tourism doesn't come back and this doesn't settle with a vaccine relatively soon. You know, it's going to be a long-lasting economic impact.
Well, let's ask a local question for you, Thomas. Ariel asks, what do you think about the Orange County beaches being open and attracting crowds last weekend? What kind of threat does that pose going forward as we get closer? I mean, apparently it's quite lovely there, but as we get closer to summer, what is the thought going into just the normal recreation that people would be doing?
Well, just before hopping on this call, I was tuning into the governor's briefing, where he, I think, berate is the correct word. He you know, absolutely implored Californians to stay away from beaches in the numbers that they did in Southern California on Saturday. I was speaking with someone earlier today in Paris, and she said, "Oh yeah, I saw the pictures of the Californians on their beaches." So those are apparently images that made their way around the world. The governor's words were, "This virus does not take weekends off." You know, he basically threatened to delay the timeline of return to normalcy, of opening the economy, if this continues. He also said something that was I thought was very interesting, and might be a new chapter in understanding how we will be followed and monitored in the coming months. He said, "I look at data every morning that tells me about the mobility of Californians." This is presumably cell phone data. And he said, "I've noticed that there's been more movement in California in recent weeks, and it's been steadily increasing." There's also data showing that tolls in bridges have been, the number of cars going through toll gates and bridges has increases as well. So I think we'll be hearing more about that as well. These, you know, the people who are in charge of deciding when we open up will be actually following our movement through our phones. That's something that said a couple of hours ago.
That's fascinating. You know, Jesse, we have a little bit of tension here in New York between the governor and the mayor. Once again, the mayor has unilaterally said that city beaches, city pools, it's all going to be shut down. And the governor has raised some questions about that, saying wondering how realistic it is that people are going to remain inside their hot, small New York City apartments all summer.
Yeah, I mean, he said on Sunday that one of his concerns was, like, you just can't have a summer and expect people to stay inside all the time. And you're exactly right; it gets hot. You know, New York City can be sweltering in July and August. And he basically called on city officials, particularly New York City officials, to figure out some activities, to figure out ways to get people outside safely where they can cool off, both physically and probably mentally as well. And by the same token, I mean, speaking of, you know, California beaches, there were pictures all over the internet last weekend that, you know, Central Park was full of people on a sunny day. And I think this is going to be the ongoing challenge. And I think it's, you know, one step forward, two steps back, or two steps forward, one step back, one of the two, where, you know, you're going to have situations where people do congregate, and probably congregate against the wishes of public health officials and city officials and state officials, and trying to kind of strike that balance between wanting to make sure that people don't go crazy in this weird reality we're living in, but also making sure that they're not endangering themselves and others. And I think that's going to be the magic balance that everyone's going to try to strike in the months and perhaps years to come.
We're going to look forward a little bit, and we have two somewhat related questions from our reader. Nancy from Sacramento asks, are both states addressing how they're preparing for the fall, if there's going to be another second wave, if you will, of cases. There's just sort of presumptions that maybe with the warmer weather, the virus might recede, people being outside as opposed to inside, and that there might be another wave in the fall. Is there talk about that and preparations going on in California, Thomas?
No question is closer to my heart and my sanity than that particular question, because
do you have children in school, Thomas?
They are not in school. They are in the hallway outside of. The governor has suggested that there might be staggered times for school in the fall. We go back to school here very early by East Coast standards. Mid-August is when it's supposed to start. So that's going to come a lot sooner than the timeline suggests that this virus will be under control. At least even this first wave. The only thing that's been said so far is that they are studying possible ways to have children go to school, but differently, fewer in a classroom, staggered throughout the day.
So while we're here in New York, my son is about to go to the largest high school in America. It has 6,000 students. Who's going to be a freshman there in the fall. And it's hard for me to even get my head around how they're just going to throw open the doors to that place in September. So Jesse, how much thinking and planning is going on in New York about the fall, about the possibility of a second wave or at least another wave as people start going out more? What is the plan that they have for this?
One of the interesting things that came up today was the governor said that he had spoken to President Trump about keeping 4 of these temporary hospitals, which the Army Corps of Engineers had built in March, keeping them active, keeping them up. And this would be twofold, that one, it would take any patients who might be involved in a second wave, and as well as people that are just suffering from the seasonal flu. And that surprised me. That showed me that they are, if not actively planning for a second wave, at least wary enough of it to tell the feds that they want to keep these hospitals up and running. And in terms of schools, the governor has been hesitant to kind of embrace Bill de Blasio's closing of schools for the year. I think very few people think that New York City school kids are coming back in June. But the fall is going to be an interesting experiment. And as Thomas said, it probably will involve, kind of structural changes to classrooms, a desk pulled pretty far apart, maybe, the teachers in gloves, or certainly security guards in gloves, and perhaps, rolling shifts of classes rather than a single school day. And I think, one thing about this crisis that has been fascinating to watch is kind of everything's on the table. There's very, very few options and very few ideas that might have seemed crazy or just completely outlandish a couple of months ago that are not seriously being at least, kind of pressure tested at this point to see if they might work, because, there have been a lot of changes to life thus far. And I think those changes are going to continue to be seen.
Well, Thomas, as we look toward reopening, let me ask a question from Leslie. Are there any practices that New York could adopt from California at this point, either now or as we think about reopening and reacting to, for instance, like containment, isolation? What could New York learn from California?
I think this is an explosive question on both coasts, because New York, as we've been talking about, has so much more mass transit. Jesse and I were talking before the call that 2/3 of all commuter rail passengers in America are in the New York metro area. So the easy answer would be, well, yeah, why don't you just become more like California? But obviously it's just not possible. And I say explosive on both coasts because it really is now feeding into a political discussion that California had well before coronavirus, which was, how do we solve this housing crisis and stop sprawling across the state and become more dense? And I think this is now, coronavirus is now inserting itself directly into that larger question. As for what lessons New York might be able to draw from California, I think it's just constitutional. It's just the way that California presents itself is something that is California. You can't possibly, import it to the New York metro area. I grew up in the New York metro area. I've taken Metro North, many times, and dreaming of entering Manhattan any other way is exactly that. It's a dream. I mean, that place, New York works because of that transit system. So I think it's a fascinating question, but I think it's a very difficult one. And that will cause a lot of political strain over the next few years.
Jesse, I take to heart very much what you said, that Monday morning quarterbacking is maybe not our best approach right now, but are there lessons that New York could take from New York that you think going forward into the fall, they might look to other cities? I think, does Bill de Blasio keep in touch with the San Francisco mayor? Are they trying to take different approaches than they originally took?
I think that London Breed, the San Francisco mayor, and Bill de Blasio do speak, and I think they're I don't know if they're friends per se, but I know that they certainly have communicated on stuff like this. I don't know if at this point New York can necessarily learn anything from California's approach for this crisis. I feel like we're still kind of in it, and we're on the other side of the apex, but I think it's going to be difficult to implement the kind of you can't time travel on this one. You can't close things down earlier, which I think New York probably would agree maybe they should have done. And you can't be more aware that you had 10,000 cases, as the estimates now are, in New York before you got your first confirmed cases. But I do think that there are interesting things. David Axelrod, the Obama advisor, used to say, "Never waste a crisis," and that's an old political maxim, but a good one. And Cuomo has talked, and De Blasio has talked as well, about what might come out of this crisis. Could you address bigger issues like income inequality, or the frayed public health system, or even, as Thomas was mentioning, the public transit system, which while it works, it wobbles. So are there ways to kind of improve that kind of day-to-day infrastructure that we take for granted, and then all of a sudden has really been put to the test in this crisis? And I think those sorts of conversations are going to be ongoing and could result in, the types of changes you saw after the Great Depression, big societal changes that really changed the fabric of America.
Well, on that note, thank you all so much for joining us today. That was Jesse McKinley, our bureau chief in Albany, and Thomas Fuller, our bureau chief in San Francisco. This event is part of an ongoing conversation series with the New York Times journalists that takes place every day at 4 o'clock Eastern Time. Tomorrow at 4, you can hear from Jessica Bennett, our gender editor-at-large, and Sally Krawcheck, the CEO of Elevest, as they discuss the impact of COVID-19 on women and issues of inequality in the workforce. To find out more about our full slate of digital events, please visit timesevents.nytimes.com. Jesse and Thomas, thank you so much for your time and your expertise today. And finally, we want to give a special thank you to all of our subscribers. You make our work possible, and we look forward to speaking with all of you again.
Absolutely.
Thank you.
Be safe and take care, everyone.